The GEM Nurse program started in 2008 at Leamington Hospital. It's a program that was started throughout Ontario, and I believe I was about the 22nd nurse in Ontario to become a GEM nurse. So I see patients who are over age 65 who live in their own home, maybe alone, or they don't have a caregiver. If they've fallen or have difficulty ambulating, if they're on more than 5 medications, if any concerns the nurses think they're frail or that they just need some extra help and attention. In a year, I believe 25% of our people that visit the emergency room are over age 65. That doesn't mean that every person over age 65 needs to see the GEM nurse. It's really just the frail ones who need extra support and who are living at home and just need that extra attention to make them be able to keep living in their own home. When I'm interviewing the patients, and often their family members are in the room, sometimes they aren't, but when the family's there and I'm asking them, you know, about their appetite and what do they eat, like they say, yes, I have a good appetite, I'm eating, the family will agree. I'm like, okay, well, what do you really eat? What do you have for breakfast? When they start listing, like, they have toast for breakfast, maybe they have toast for lunch, just because it's easy to make, and their family's not realizing that. Or have you fallen? No, I haven't fallen. Well, have you ever got up off your chair and fallen back into your chair? Oh yeah, I do that a lot. Well, that's really a fall, so what can we do to help you with that? You know, and I think difficulty with medications, you know, it's really just asking those questions that maybe they don't want to tell their family or bother their family, and we just really try to get down into what's happening at home so we can make it better and easier for them. You know, the emergency room is very busy, as everybody in the community knows, and in the GEM nurse we just have extra time to spend to listen, which is most important, because often staff, you know, they're so busy and the call bells are ringing and the ambulance patch phone is going off and people are coming in constantly. You know, sometimes the nurses don't have the time that they wish they had. So the GEM nurse has time to listen. Just talking to an older adult takes time. And listening to the family. So, you know, the GEM nurse role is unique in that we have the time and the ability to spend with the patient more time. I think when I met Mr. Hebert too, when I first met you in December, and then I met you again after Christmas, and your daughter, maybe it was January, February, and your daughter was really worried about you, and she, because you live together, she's like your caregiver.
Right, she is very much so, yes.
And she was feeling stressed because you weren't feeling well.
Right.
And it was almost like she was burning out.
Yeah.
She was like, I don't know what to do with that. I just want him to be better. Can you just fix him? And I talked to you. We didn't want to really have a procedure done that we felt was quite necessary for you to feel better.
Yeah.
And I talked to you and I listened to you. And then you decided, yes, you'd do it. You would just do it. And after that, you felt better.
Yeah.
And then I think I referred you to CCAC for a little bit of home care.
Right.
And just until you felt much better.
Right.
And you know, we talked about medications, what we could adjust to help some issues that were happening at home.
Right.
And I think, you know, I helped you, but I feel like I helped your daughter.
You did. You
too,
did
right?
Very much so.
So it's kind of like it helps your whole family.
Right. Right. Brings our morale right up and boosts us right up. Wonderful. You are a wonderful bunch of nurses here. Beautiful, wonderful nursing staff. Beautiful, wonderful doctors. Even your kitchen staff and your auxiliary staff, they come in, they smile, a big smile, and they build your morale right up. Nursing staff, medical staff, nursing staff, auxiliary staff, you're all a bunch of wonderful people. It's marvelous, marvelous. I can't say any more about you. You're just perfect. And you have been so kind to me, Lisa. You have been, your professional knowledge really saved my life on several occasions. And I'm telling you, and I want to thank you so much for it.
Well, you're welcome.
Yeah, I know that, and thank you so much.